going to start off with a brief introduction while we get our technology sorted. So hello again, city colleagues and partners. For those of you I haven't had the pleasure of meeting, I'm Lauren Sorkin from the Global Resilient Cities Network based here in Singapore. And along with our co-host from the World Bank, it's my pleasure to welcome you to our 8th edition of the Speakers Series tonight. In Asia, where I sit, 8 is a very lucky number. And I'm certainly feeling very lucky tonight to be hosting Mayor Fischer and Eric Friedlander, who is the Assistant Secretary for Health, direct from Louisville, Kentucky. Mayor Fischer and Eric are here to talk to us about 2 very critical issues, equity and compassion. Reflecting on the last 8 weeks of discussion, these are issues that keep coming up. COVID-19 has disproportionately large impact on our poor and vulnerable communities and on minorities. And our responses and our recovery have to address the systemic problems and not just symptoms. So tonight we will hear about how the Mayor and Secretary Friedlander are responding to COVID with compassion and the Mayor's plan to build back better, to create a city that is even more equitable and stronger than before. And I have to say that on a personal note, it's really special for me to be facilitating a discussion for Mayor Fischer and Eric from Louisville, because about 45 years ago, a young woman left the East Coast of the US to pursue a master's in art therapy so that she could help troubled youth in our community. And that woman, my mother, Barbara Sorkin, studied at the University of Louisville and then went back to work for Mayor Schaefer in Baltimore. And I know she's tuned in tonight, so I'm going to take this 10 seconds just to say happy early Mother's Day, Mom, and thanks for everything. So now, before I turn the floor over to Francis to introduce our speakers, I want to remind everyone of the ground rules. This is a community of urban resilience practitioners, so this will be a frank and honest learning conversation. And this is a conversation that is not on the record. So if you do want to quote the speakers tonight, please reach out to our team and we will clear that with them first. I also want to remind everyone that in the WebEx app, you do need to post your questions in the Q&A chat function, and we will field and collate those questions during the Q&A period. And with that, I want to turn it over to Francis from the World Bank.
Thank you, Lauren. My name is Francis Guestière, and this is Kai, who doesn't want to go to bed. So I first would like to welcome everyone on behalf of the World Bank City Resilience Program. As most weeks, we will have 2 speakers today. We are honored to have Mayor Fischer, Mayor of Louisville, Kentucky, who's a known champion of resilience and currently president of the Conference of Mayors in the United States. We're very honored to have you here, Mayor Fischer. And we'll also have Eric Friedlander, who was the first CRO of Louisville, and he recently left the city to become the acting secretary of the State of Kentucky Cabinet for Health and Family Services. Together, they will help us explore the interaction between 2 levels of government during the recent pandemic and how a shared foundation of resilient thinking and concepts like equity and compassion have helped them achieve positive outcome. Eric will speak first to us, followed by Mayor Fischer. They will both speak for 15-20 minutes, which will give us ample time for Q&A. Without further ado, Eric, the screen is yours.
Thank you. First, I'd like to just thank you for the opportunity to speak today and to speak to some of my friends in the Resilience Network. It's an honor. It was an honor to be a CRO, and I learned a tremendous amount, which actually prepared me, as if anything could, for what we're facing today. I was working for the city of Louisville as a CRO. We had a great team of folks that were working, and my experience was primarily in state government in this cabinet for 30 years, and I learned such a great deal from the CRO network and from working for the mayor of Louisville, Greg Fischer, that I wanted to bring back to the Cabinet for Health and Family Services. Those of you who are not U.S. Or Canada, the Cabinet for Health and Family Services, state government, compare it to some of the regional governments, is a big cabinet. In the United States, we don't have necessarily universal health care. Our social service system is a bit different than the rest of the world, to say the least. So I was asked one day on a Sunday to come back to the state, and I had to call the mayor that afternoon and tell him I was leaving the next Monday at noon. So he was very gracious to assist me in that transition, and I appreciated it. So I came back to the Cabinet for Health and Family Services. And I had lots of plans to bring some things back from what I learned from resilience, what I learned from the mayor about compassionate leadership, and was hoping to instill a lot of that within state government. I did not necessarily plan for a worldwide pandemic at that time. So that was quite the shock. As we talk about, and then the stresses, of course, of a state that is a little bit older than most states, not quite as healthy as most states. So going into it with some real challenges. So it was great to have the opportunity to be a CRO. I was not surprised when I walked into an emergency operations center. I was not surprised when I walked into a state health operations center, and knew that it was going to require different level thinking. So it turned out that the person who's in charge of the Emergency Operations Center for the state, Michael Dossett, happened to be my one governmental representative on my resilience team in Louisville. It's a small state sometimes. The state capital is in Frankfort, Kentucky, which is about an hour from Louisville. But he was the one that I reached out to help with resilience planning for the city. As you know, we talked about resilience in Louisville as being an equation. We came up with what we called our Louisville resilience equation, which was Louisville resilience equals equity plus compassion plus trust. Because as you all know, it is always the most vulnerable who are first hit, take the longest to recover from any of these shocks that we see. So in Kentucky, we had our first documented case on March 6th. I'm very, very happy to work for a governor who actually believes in science and was willing to listen to his public health commissioner and take action quickly. We started to shut things down in the state on the 10th of March. We began closing some of our healthcare facilities. We shut off visitation to long-term care facilities. We then closed some front-facing businesses, and we did that in a way, and it was a plan to acclimate the general public as we could to adding a restriction every day, every other day or so, and that seemed to work well. It didn't cause panic in our population, and we were trying to balance the needs of science with social science. So as we did that, we worked through several things. Those of you, again, in the main healthcare system for folks who don't have health insurance in the United States is called Medicaid. We took a lot of restrictions that had formerly been on that system and taken it off. We've added about 150,000 people to the Medicaid roll, so we're up to a little over 1.4 million who are on Medicaid. That is within the Cabinet for Health and Family Services. There's a program, food stamps, or it's help with folks getting food. It's called SNAP. We've also increased that by almost 200,000 folks by this point. We're serving over 600,000 people. When we came in, all of that was declining. There were fewer folks enrolled in Medicaid. There were fewer folks getting food assistance. And it was more a philosophical difference with the previous administration. And we actually believe that people should get benefits and help, which was a significant shift. So we we brought up the shop. We changed our eligibility rules. In a week, we moved everybody who was working in a building. We have about 7,000 folks that work for the Cabinet for Health and Family Services. And we probably moved 6,000 of them out within a week or two. This is something that I was actually hoping to do over the next several years. But we were able to do that in 2 weeks without an interruption in service. And so it showed that we could actually be nimble when we needed to be, and make changes when we needed to. And this is something that I hope that we will learn from. I've stolen from the mayor a couple of folks to help with that documentation piece. And again, as we look in Kentucky, we feel really fortunate. If you pull up a CDC website and you look at the surrounding states, they have all been hit more significantly with more cases than Kentucky. Kentucky kind of stands out a little bit, and it's because we implemented social distancing very quickly. We shut down visitations, like I said, to long-term care and hospitals. We worked on how we could get funding to those organizations. We set up our surveillance pieces very quickly, but not quickly enough. I think as we look back, the only thing we're going to question is, could we have done things more quickly and more aggressively? So we think relative to other states that we were able to do that. And as I say, I'm very fortunate that the governor here has seen fit to actually listen to science. The Health and Family Services Cabinet, and I meant to do this earlier, is a conglomerated cabinet. We have the Medicaid program, as I said, mostly for folks who are uninsured, has about 1.4 million individuals who are insured through that portal. We have what's called our Department for Community-Based Services. That's the social service agency. It's the agency that really works on eligibility and also then works on child protection and adult protection. The social service, social worker, but that group is there. We also have the behavioral health group, and that group really works on mental health and behavioral health, and I'll get to this slide in just a second. Thank you. Good timing. As well as our long-term care group. It's called the Department for Aging and Independent Living, the groups that oversee healthcare and the licensing and inspection of healthcare systems, as well as then the group that's been the most important group during this time is the public health group. And that's the group that has the epidemiologists, the folks that do contact tracing, the folks who are helping with testing, the folks who are helping with the Emergency Operations Center. Just so happens we have a former emergency room doctor who is leading that department, and I can't imagine a better person to lead at this point. As I was looking at, and what I learned from Louisville about resilience, when we were working on our resilience plan, the theme that went through everything was concerned trauma, right? And how we look at trauma, how we process trauma. And one of the things from the previous years I've been at this cabinet, we had not paid enough attention to that, even within our workforce. So learning from some initiatives in Louisville, there was a Bounce Coalition. It's actually part of the Louisville Resilience Plan, of the importance of trauma and trauma-informed care. And I came and there was a small group that was discussing that, but I have now elevated that group to talk about trauma and equity. And so we've changed so many things so very quickly. I talked about how we've gone to primarily a virtual environment from work. We've done that with our healthcare. We have increased the telehealth portion of the healthcare. We had very little of it, and now that is primarily what people are using. We started virtual recovery support services for folks who have substance use disorders, as well as those who have serious behavioral health and mental illness issues. We started some of our virtual foster care services. So we changed everything we were doing and moved to a virtual environment that we really had not gone to before. And we did that all within really about 2 weeks. For our staff, we have now our telework options, and we did it seamlessly. in February, before we started this telework piece, we had a phone service, a phone operation that I told the governor when I came in. I said, our eligibility systems are broken, and they were. And we had about 10,000 calls to our eligibility line per day, and we were answering 4,000 of them. We had abandonment rates of 20 and 30% on the lines, and this is when people were in offices. So we moved everybody to home, and we made a few enhancements to the lines, but as of yesterday, we're answering 10,000 calls with an abandonment rate of 0.5%, with a call wait time of 8 seconds as opposed to 20 minutes. We have made significant changes in the midst of crisis. We have also then talked to our staff and sent out resilience messages. Actually, that's what we're calling them. And it's about really how to take care of yourself in time of crisis. We've also then added some resources because as we've worked with facilities, when they test positive, particularly long-term care, and that has been really the biggest challenge for us in Kentucky. And I think in many ways across the country, our long-term care facilities where folks actually live together in one facility, and that applies also then to prisons and other facilities, those are the populations, the confined populations that are most vulnerable. And the COVID-19 virus spreads quickly. And so we've had to actually use some trauma-informed care with administrators whose buildings are falling apart, essentially, and trying to support them and figure out ways that we can support them, usually through a trauma-informed lens. And so we're bringing resources there. And to the public, as I said, the governor has done a great job of having daily press conferences, the mayor as well, and to do it in a way that's reassuring, understanding that repetition and order is reassuring. And we have really strived to present a very similar message each time. And when we bring new pieces in, we introduce them slowly. And it really is a plan for how to bring the general public along with us to understand what we're facing and to try to provide good, solid, factual information, which seems to be refreshing in this state, as well as then the messages we have to the general public. Please sign up for services. Sometimes those services there's a stigma attached to them, but in time of crisis, they are important for us and important for the whole community. We're talking about the uninsured people who sign up through Medicaid. It is not just for them, it's for the providers to make sure they get paid. So we've been trying different social messaging. We use all the social media platforms that we can. And so we've increased eligibility a tremendous amount, and as well as then services for behavioral health and access to individuals to get there. So with that, I just want to say there were lots of lessons that I learned being a CRO in the city. My experience, the reason I came back to the state is my experience was here. And I hope that I've been able to give some good leadership and good understanding to the various programs that I just described. But when I was with the city, as I said, I learned the importance of compassionate leadership, dedicated leadership, as well as what we do in Louisville, which is we have strong measurement pieces where we try to have data-driven decisions. And I really have tried to bring that with me to the state, even though at this point, I'm still trying to get that implemented. The biggest challenge has been in a bureaucracy, right, in government, when this worldwide pandemic is something that we have not seen in our lifetimes here in the United States, certainly, really having to change people's perception, having to change people's mindsets. Bureaucracy, governments often, excluding Louisville, tend to get in a rut, a groove, because we depend on regulations and we depend on policies and we depend on procedures and we depend on these things to kind of keep us safe and bound in with what is acceptable and what is not. In this time, that had to go out the window, and we had to do things in ways that we had never done before, and think about things in ways that we had never done before. The Emergency Operations Center, they were used to dealing with a tornado or a flood in a specific county, but something that hits the entire state required a different level of thinking. And I would say that has been the most challenging piece to get across. We've done it, but it takes a while for people to let go of their mindsets, particularly as they've been looking at things in the same way for 10, 20 years and been taught that's the way they need to look at things. So that is what I've seen as the greatest challenge. And actually, working as a CRO and getting the perspective, the worldwide perspective that I gained from that, I think I was able to impart that to my team and the folks who are working for the cabinet in a way just that was supportive and challenging and was able to get them to move. I also think the mayor of Louisville has provided me a great example as well of how to do that and how to proceed. So with that, I would like to turn it back over to my mayor in Louisville.
Thank you, Eric. Appreciate the kind words on that. And yeah, little did you know when you were going back to the state capitol that you'd be dealing with this, but I couldn't imagine a better person dealing with this right now. So I really want to say thank you for you and your leadership. And good morning, good afternoon, good evening to everybody. Thank you so much for letting me participate. I'm Greg Fischer. I'm the mayor of Louisville, Kentucky. And I'll be sharing a few comments about our reaction to the pandemic and how we've been building our city and reacting at the same time. You know, what's interesting about the pandemic is that it did not cause the inequities that we have so much of in America, but it certainly has revealed them in a stark way. And if there's anything good that can come out of this, I hope it's the increased consciousness of people that had not really seen inequity before. While it was all around them, it really didn't impact their lives. So there's been a lot of questions asked about, why are things this way and why are these people impacted? And so I'm hoping that we can rebuild a better America and a better Louisville coming out of this. To do that, we've got to be guided by good, strong values. Obviously, resilience, equity, compassion is important. Compassion is a city value that I've been accentuating for the 9+ years that I've been mayor. And by compassion, what we mean is respect for every person so that their full human potential is flourishing. So if you lived in a city or a state or a country where everybody's full human potential was shining like the sun, what Thomas Merton said in his epiphany here in 1958, what a wonderful world that would be. So all of our jobs, I believe, is to help each other's human potential flourish, whether it's in, quote, normal times or this new normal time that we'll be getting into here post-pandemic. The other thing I've been using this opportunity for is to really ask people to think about this notion that, America is called the richest country in the world, and that's often said with great bravado. The reality is that we might have the largest gross domestic product per capita, but the amount of inequality in our country when it comes to housing, food, access to good education and healthcare is nothing to be proud of. And it is not the hallmark of a country that wishes to be called the wealthiest or richest or what have you, and makes us question even what wealth is, right? Wealth should just not be a financial measurement. Basic quality of life issues must be taken care of for everybody so that their full human potential can flourish. Then maybe you can start saying, okay, we're doing some good work here. But we have to use this pandemic to learn, to be introspective, and then to improve coming out the other side of this. A few comments on how we prepared for the pandemic. Obviously, America was able to see the experience going on in China and then Europe. And so we had some time to think about this and prepare for its arrival from a psychic standpoint anyway. Our country's response in terms of preparing for arrival has not been a best practice, I think it's fair to say. But we were able at the local levels to say, okay, it's coming. What are we going to do about that? So before it really hit us here, I said, let's put three things in place that I know we're going to need. One was a community response fund that people would want to help folks that were impacted by the virus. So we created something called the One Louisville COVID-19 Response Fund. We stood that up in about 72 hours. We've raised about $10 million so far. All as quick as it comes in, it goes out. It's helping individuals and families that have been financially impacted by COVID-19. So that's things like rent, food, utilities. And I'm really proud of our city, the way we responded to this, to helping each other. Again, that's part of our notion of compassion. That was the one issue. The second issue was we needed to move faster to close the digital equity divide that was in our city, because we knew that we were going to have to go to online learning with our public school system. It's about 100,000 students or so, Jefferson County Public Schools. So we were able to really move it, kind of per Eric's point, move at a speed that we were not able to move before, to make sure that families that did not have the proper hardware or internet connectivity were able to get that, so that their children would be able to learn online. And that's really been a really fantastic success. And so it's not only helping us obviously with students right now, but that's going to help us for the long term as well. And then the third issue, or the third project we created to get ready for this, was something called Lift Up Lou. So Lift Up Louisville. And so I thought during World War II, America had a morale building department to keep the country's morale high, and we could be focused on our objective. And so I thought we would need the same thing with this pandemic coming, that we're telling people to be socially distanced, but we're social creatures. So how do we keep us together during a crisis like this? And so Lift Up Lou provides that kind of rhythm for us. And we have a slide on that, Nini, if you want to put that up. It's my second slide, I believe. And so Lift Up Lou is an effort that pulls the whole city together and provides, let's see, we go to the next slide, provides a rhythm of the day. So during a crisis like this, you have to, I think, have a new rhythm. And that's what Lift Up Louisville does. Can you go to the next slide? There we go. Okay, so this is typical of like what a day is. So if you're now staying at home, your kids are at home, let's start with some fitness in the morning. We have a learning activity, arts and entertainment in the afternoon, and then we close out the day with a mindfulness exercise every night. So this just repeats throughout the day, and this has been a wonderful way to bring the community together and creativity to create a rhythm that people can get used to, and then stay fresh and stay learning while they're doing this. One of the things that came out of this was the creation of a community song called Lift Up Louisville that had its global release on Monday. It's been received with great recognition all over the world. I know we're going to send that out to everybody, so if you take 5 minutes and listen to it, it's a song that is a song of the time right now, of a city coming together while staying apart, moving through this pandemic. And we all have soundtracks to our lives, regardless of what your age is. If you're in Louisville, this is going to be part of the soundtrack of your life as we get through this. So, and I would encourage other cities to pull their songs together. This was a collaboration of about 30 Louisville musicians that have national reputations, and it's quite extraordinary. So please listen to Lift Up Louisville and tell me what you think about that. All right, let's go back now, Nini, to the slide you had before this, if you could. Thank you. So just for some context, Louisville is a city of about 800,000 people. We're in the heartland of America, we're not the Midwest, we're not the South, we're kind of just in between that. So we're Louisville is what we say. We've got a population, as I mentioned, of about 800,000. We're the proud home of Muhammad Ali, Thomas Merton, and 95% of the world's bourbon comes from Kentucky. So the other 5% is counterfeit. So I'd encourage you to stay away from that. So bourbonism and bourbon tourism and good local food is part of what we do here. We've had so far almost 90 people pass from this virus. We have been able to flatten the curve here with great participation from our city. So our hospital system was never overrun, but some of our long-term care facilities, of those 89 folks, at least half of them are senior citizens. So our senior citizens in particular, like places all over the world, have been particularly hard hit by this disease. So that gives you some perspective for how this has impacted our city here. But as I said, I'm very grateful that our healthcare system has had plenty of capacity and will have plenty of capacity. We're now in the phase of starting to emerge from our healthy at home phase to come out now where we're starting to loosen up a little bit and put more stringent social distancing practices in place as we loosen up, face covers, mask wearing mandatory, et cetera. So everybody around the world knows these drills by now. So when we move off this, Eric talked about this somewhat. We've been emphasizing the importance of taking care of your mental health throughout all this. In America, the surveys show that over 50% of the people are struggling with some type of anxiety, some type of depression. As we say, that's normal, right? I mean, our world is being turned upside down right now. So if you weren't feeling a little out of kilter, then maybe that's abnormal. So we are really front and center on talking about mental health issues as being normal, addiction issues being normal, and then how do we work through all that together. So our Trauma Resilient Community Initiative has been a broad effort to inform and build networks of trauma resilience providers throughout the community so people could go and get assistance when they need that. So that's kind of dealing with issues, and there's all the other kind of things that we're doing, but we're also preparing for the future. So our Future of Work initiative is as active as it ever has been. We're repositioning our economy. We're always doing that, but in particular, before this pandemic, we were having a major focus for repositioning our data skills in particular in the new data economy around artificial intelligence and machine learning. And so that's up and running in full force here. Just to give you an example, we announced a free online training course for artificial intelligence. We had 2,700 people respond in the first 24 hours. And of that, I was very pleased to see that it was a very diverse crowd. Louisville is about 68% white, about 22% African American, and 10% foreign born. Of the participants of our first Future of Work initiative during the pandemic, virtual obviously, 59% are women, 20% African American, and the balance foreign born. The most rapidly growing area of entrepreneurship demographically in America are African American women. So that's a wonderful thing to see when we think about equity and empowerment and entrepreneurship. And we're seeing that with our Future of Work initiatives as well. Just a few of our challenges that we've had as we've worked through this COVID-19 crisis. As I mentioned before, America has struggled throughout our history with equitable treatment of minorities in particular, and that manifests itself in several different ways. And the pandemic has really revealed that. In most American cities, there will be, and cities around the world, I would say as well, there could be a 10 to 12 year life expectancy difference between the part of the city that has the most advantages and the most resources and the part of the city that has the least advantages and the least resources. And that's true here in Louisville as well. So of our mortality, our deaths from the pandemic, while the African American population makes up 23% of our population, African American population makes up about 30% of our deaths here. So about a 40% disproportionality. And I'm sad to say that that's a low number compared to many cities in the United States right now. So it's screaming at us, right, that, hey, something is wrong. What I see is talent is equally spread, but opportunity is not equally spread in our country. And it's our job coming out of this pandemic to make sure we come out of that with a different system. On the day-to-day management of that, our incident management team is the nerve center for the city's response to the pandemic. And one of their guiding values when they make decisions is the value of equity. So all of our programs and initiatives are guided first by equity, and then resource allocation follows after that. The last point of this is how we're building back. So our initiative is called Building Back Better Together. with the key point of together. A lot of people have heard about building back better, but we want to do it together in a different way, in a more equitable way, in a more compassionate way in our country. So it's not going to be good enough just to go back to what we were. When people say, oh, I want to get back to the way it was. No, that was a very inequitable, uncompassionate way to design the systems in our society that has given us the results that we have today. And so we have to fundamentally redesign these systems so that they produce more equitable outcomes, so that everybody feels like they are connected to a bright and hopeful future. And that's what Build Back Better Together is. That's up on the web if you want to check out what all that's about. But we have to fundamentally get through this inequity that we have in America. In America, 40% of our population cannot get through a $400 emergency. That is the definition of living paycheck to paycheck. And that is being revealed right now, what that means. And when that paycheck stops, there's all kind of crises that start happening at the family level. Yes, there has been government support that has been provided, but we need to take that government support and turn that into systems that produce equitable outcomes so that everybody can have the resilience to get through a crisis. And I pray that we don't ever have to go through another pandemic in terms of a crisis response. But we certainly should use this right now to produce a better Louisville, a better Kentucky, a better America, and a better world. So with that, I'll stop there and thank you all for the opportunity to speak. Mrs. Sorkin, if you're still on, I want to say thank you for being a University of Louisville graduate, and you worked with a great mayor there in Baltimore, Mayor Schaefer. So please come back and visit us in Louisville.
Thank you so much, Mayor Fischer, and thanks also for that kind shout out to my mom, who's definitely online and listening in. And also is now a nurse and a therapist. So this has been an interesting time for her as well. We have a number of questions here about your remarks, and thank you so much for them because they really focus these issues and give very clear value-based guidance for how we can move forward and build better together. One of the questions comes from our resilience team in Israel, actually, and they wanted to hear more about how the city and also Eric at the state level, how you're dealing with housing solutions and helping people out when they might have trouble, as you said, making it through this crisis, paying their rent or their mortgage, and allowing them to feel safe in place.
Yeah, we've got an order both at the local level and state level that evictions are prohibited during this crisis, and we're also working with. So we have A, financial assistance, B, prohibition to landlords if they're given any kind of problem or eviction notices, and we're looking for landlords that are doing that. Fortunately, we haven't had any. But then we're also dealing with the reality of to the landlords of like, who are you going to rent this to? I mean, this is a pandemic that has hit everybody. So you are far better off working with your existing tenant than you are kicking them out. So we're approaching it from a practical standpoint, a compassionate standpoint, and then financial assistance as well.
And I would say housing is one of the challenges in the United States. There's been a lack of funding for probably a decade or two around providing sufficient support for housing. We've changed a couple of things in terms of our Medicaid program to allow some short-term housing opportunities, particularly for those folks who are homeless. But that's been a slow process to get approval through our federal government. But we are, as the mayor said, trying to make sure that as funding comes through and they go through some different organizations in our state, that we talk about, well, we've got healthcare and hopefully we have some food assistance pieces covered from the state. But as we provide more funding to the local level, we're hoping that some of that funding will go for those pieces that we haven't been able to account for, and housing is one of them.
Francis, you're on mute. We need to off mute.
Yes, I was double mute because children were asking questions. Thank you, Eric and Mayor. I think we're going to move from detailed question about what's happening now to bigger picture over time. But there was one question from a participant asking really, how have you gone about quarantining people when you identify them? How have you organized that? And also, how have you allowed them to stay in touch? For example, children who are separated from their parents, how do you deal with? These are very practical, difficult issues to deal with. And I think people will be interested to know some of the experience you have had in Kentucky and in Louisville in particular.
Eric, you want to take that, or you want me to?
Sure, I can start. So the state government has had some significant authority based actually on tuberculosis a long time ago. We had some really trouble with tuberculosis in the 20s and 30s. And so some very strong public health laws were written around quarantine and the powers of the state to do that. But what we've tried to do is appeal to people's sense of civic duty and asked folks if they test positive to stay, the governor says this, stay healthy at home, and that's for everybody. And so within that, folks who are positive, we've given some guidelines about how to stay healthy at home, how to separate from families, but we've allowed them to do that within their own dwellings as much as possible. However, there's always somebody who I don't know, ruins it for the rest of us is the way to say that. But there have certainly been times when we have had to order a quarantine. And we've gone actually through our local governments to ask them to assist in getting orders from the court to order people to quarantine. And different municipalities have done it slightly differently. We had sheriffs posted in front of somebody's house in one county. I know Louisville's had some challenges with that. And I think, Mayor, if I'm not mistaken, we even had an arrest yesterday or the day before. So there are pretty strong powers to enforce quarantine, but we've been fortunate. That has been the exception in the entire state of 4 million people rather than the rule. So I think, again, the way to introduce how we've introduced to the population that this is serious, that the healthy at home piece, and asking people to do what is right for not only themselves, but their community has actually, for the most part, been very effective. And I'll turn it over to you, Mayor.
Yeah, I mean, look, we've compassion has been our guide on this. And by compassion, I mean compassion for like the entire population. So if you have an outlier, which we've had 2 or 3 outliers that do not want to comply, we have used our home incarceration program to make sure that they are staying at their homes. In other words, that's an ankle bracelet, so we know where they're at. For whatever reason, they wouldn't comply. We're not going to allow them to be out in the public. I mean, it's like running around with a weapon publicly and using that to harm people. And Lord knows we have enough of that in America as is. We don't need someone that's COVID positive doing that. So we see that as a compassionate response. Now, as we're entering this phase right now of releasing restrictions that we have a really robust contact tracing program that has a isolation and quarantining aspect to that if you cannot isolate at home, quarantine at home, and keep your loved ones safe, there'll be housing for you, food and medicine, perhaps a per diem if that's required, so that the whole principle is you being quarantined, whatever it costs, is a better investment to make that cost than allowing you to be on public transportation or what have you. So we realize that there's some practical restrictions and implications to that. So we're putting in programs to respond to that.
Thank you.
That's fine, and that's what we've tried to do in terms of across the state. But again, we've been very fortunate that we haven't had to use that often.
Thanks, Eric. Thanks, Mayor Fischer. The next question is about small business. Mayor Fischer, the record that you have in growth of small business during your tenure is a very impressive one, but clearly this is a community that's suffering a lot right now. Can you speak a bit more about how you're thinking about sustaining and in fact, and then in the future, growing small business?
In any city in the world you go to, that small business usually is the soul and provides the vibe of the city, and usually the quirkiness and creativity, and it's certainly no exception here in Louisville as well. So we've been working with our Independent Business Association to make sure that their job one from day one was to make sure that they had a streamlined approach toward any federal relief that was coming in. That America's had large relief programs. The key is getting in line so that you make sure you can get those funds quickly enough so you can survive. And it's usually getting from when the crisis starts to that arrival of funds to at least then you hold on, because what the problem is, of course, is none of us know how long this is going to last. And while we're removing restrictions right now, how much will business start back up? So we've had some good federal programs. They're going to need to continue to be funded. And then at the local level, we created small business loan programs also. Those were targeted on small companies, companies with 10 employees or less, so that they could get through this. And again, that's really one of the big questions, is how long is this going to last? But small businesses have been a big focus of ours, and specific products we've developed. You can see at louisvilleky.gov what those look like.
And then from the state perspective, particularly this cabinet, some of our small businesses relate to child daycare, some of our smaller, more boutique healthcare providers. And we have tried to provide every opportunity, particularly on the healthcare side, for people to continue to participate through telehealth. And then we are using some of our federal funds to support some of those child daycare centers that we don't have enough of in this state. So we can't afford to lose 30 and 40% of those providers. So we are providing some ongoing assistance to them, hopefully so that they can get through this.
Thank you. We have quite a few questions about exit strategies, or you've mentioned that you've started to loosen up, some of the restrictions. Questions around, well, have you identified different phases in your exit strategy? What are criteria are you are you thinking of using to move from one phase to the other? And then what element will be included in the different phases? I think everybody understands that everybody is developing that thinking right now, but what's your thinking at this stage on how gradually to move out, or maybe have monitoring and strengthen again in the process?
Well, in Kentucky, we are looking at it at different phases. We are beginning what we call our phase one. It is primarily related to loosening the healthcare side. We have closed down everything that we call this urgent, non-emergent, and non-urgent. And so we have really kept things to that urgent and emergent piece. So folks that are have some active illness, and not just COVID, but limiting what we can do and what we expect folks to do in terms of in-person healthcare. We know that as we're trying to ramp up testing, we need to bring up really some of the rest of the healthcare system. So beginning just next week, we felt like the important thing to do was start to allow some in-person meet with proper PPE, proper personal protective equipment, proper disinfection, and proper distancing and infection control protocols. And the folks that we thought would have the best time with that, or had the most opportunity to do it correctly, was actually in the healthcare field. So we've laid out several steps about the slow reopening of healthcare kind of throughout this process, and then taking that out to some manufacturing and eventually some retail, but all with monitoring our infection rates and monitoring surrounding states, making sure that we don't see a second spike here in Kentucky. We really have, the governor has called it cutting the top off the muffin. We really have not had the spike to where we were overwhelmed, and making sure that that doesn't happen. So staging that in a way that we learn from, can we do this? Is the social distancing correct? So like I say, the healthcare is first, making sure that that occurs, and then trying to think about how many people are going to come in contact with what we open, and again, trying to limit the number of people that could potentially cause a greater infection rate in the population. So as we're thinking about opening this kind of phase one, really following some of the phases that are outlined by the federal government to make sure that we don't create a spike in infection. So trying to go slowly, hopefully, I like to say, letting everybody else go first in surrounding states and learn from their experience. But that's been our plan, to open and reopen quite slowly and hopefully judiciously. But at the same time, watching our healthcare sentinel pieces where we might have to then intervene. And so we're bringing up our contact tracing, we're bringing up testing in this country and also in this state. And we still have more testing capacity that we need to have and more contact tracing that we need to have. But this is something that we are continuing to work on day by day and something that we hope we get to the point where as we do these slow openings, we haven't caused ourselves a second spike.
Yeah, so think about this as a beautiful dance, hopefully, that's going to come together with removing the restrictions is aligned with more testing capacity, which is aligned with more contact tracing capacity, so that if it all works harmoniously together, then that'll move to the next stage after that. So that's the theory. Of course, we need social compliance to get this done while we deal with some of the practical issues of building up testing capacity and more contact tracing.
Thank you both. The next question is more along the lines of values, mindset change, and also this practice, Eric, that you talked about of this trauma-informed care and how this reinforces compassion and how this helps to build resilience both at the city level and at the state level. So can you talk more about how you actually do that and how you create that kind of a culture within government?
Well, that's a great question, and I'm also interested to hear how the mayor responds, because he has been a champion for doing this, and I've learned from him. But the way that we're trying to do that is really just address it, right? And the mayor said it. We're not going to come out of this the same way we went in, and to be very clear, that's not the expectation. This is an opportunity to make great changes, and the opportunity for people to understand that it is actually what your neighbor does. What happens in another community does affect you. And oftentimes we get so insular in our smaller communities within our state, within our city, that we lose sight of that. So by keeping that in the forefront, by talking about the trauma that we're all going through, the shared trauma that we're all going through as an entire community, making sure that's up front as we begin what will be how we come out of this, and keeping that in the forefront and talking about, again, that trauma and what that means, and how we're all connected. Not only the people that work for the Cabinet for Health and Family Services, which again, that is often a very siloed structure, but we can't do it alone. The governor, every time he says at the end of his press conference, in the beginning of his press conferences, we will get through this, and we will get through this together. What I've said within the cabinet here is not only we will get through this, but it's the only way we're going to get through this is to get through this together. And emphasizing that in everything I try to do, in what I try to model, and what my expectation is for everyone that is working for me and with me to model. And so that's been a very important piece that the governor's tried to do. It is something the mayor has done for years in Louisville. And so I think the importance of that leadership and modeling what you want to see, what you want to encourage, is critical as we move forward. And then as you think about rebuilding, you have to remember that the trauma-informed is really the most important thing that we're going to do, because we're all coming through that and from that.
I'll just add to that. I mean, yes, this pandemic has been a trauma for a lot of people, but what about the trauma for the already traumatized, right? And that's really how the roots of our trauma resilient initiatives have been in Louisville, to address systemically ill-designed systems to address institutionalized racism that has been present in this country since the first ship of enslaved people arrived 400 years ago. And so that's the root of our work in this area, because when you take a look at what causes most trauma, when you peel it all the way back, I mean, poverty is usually at its core, and the inaccessibility that people have because of poverty and lack of education and healthcare, all this. So in my office and mayor's offices around the world, most of what we deal with is because of issues related to poverty, lack of access, crime that might come from that, other type of challenges. So this pandemic has revealed all of those. If we're not smart enough as a society, as a global and national society, well, shame on us for not addressing these issues. So what we have in place now is a trauma-informed network through the city of providers, whether it's in person, we can't do that right now, certainly telehealth as well, but then also ambassadors that we train through the city. We just completed our most recent class. This class was done virtual of our Ambassador Institute. We trained 46 people that have new skills to recognize signs of trauma, to refer people to counseling if need be. So we've got a short-term issue, yes, of this pandemic, but it's a longer-term issue of peeling back all these inequities to get to a place where everybody feels like they have what they need and actually do have it to live a life of opportunity and creation and rid any type of hopelessness or despair that might be present in too many of our communities of poverty.
And Mayor, thank you for that. I'm sorry, just for 1 second. And thank you for that systems piece, because as we looked at our eligibility systems, we were inflicting more trauma. So we have to redesign our systems, not make people wait 4 hours in a waiting room when we can get something done in 5 minutes. So and we're learning now through this process that we can. So let's do it.
I cannot think of a better presentation to really inspire this trauma-informed network. I can't thank you enough, Mayor Fischer and Eric, for the wise words that you've shared with us that are based on your practice and your experience. I think you've left us with this concept of, what is the possibility of being a trauma-informed network and addressing head-on what the problems are with the system that we have this once-in-a-lifetime opportunity to address right now. And that really brings us to the close of this session. But I want to say that next session, next week, same time, same place, WebEx, we are going to be back, and we're going to be talking about what it will take to get to that resilient recovery and how we as a global community, this global community, and trauma-informed network can use this experience and opportunity to, as the mayor said, speed up the changes that we know we need to build resilience. And so I hope that all of you who are signed on tonight will join us again next week. And again, I just want to thank Mayor Fischer. Thank you, Eric, for being with us tonight, and our co-hosts from the World Bank. Thank you all very much, and we'll see you again next week. Stay healthy, stay safe.
Be well. Thank you.
Hey.